Yes, yes.
Oh, girl, stop. No, no, stop.
This is the
No, look,
Lisa
no, no. I'm gonna tell
Baxter
you like this.
Show.
When
Giving
I
you
first
the
got to the dialysis center, I didn't want to do
in the
anything.
kidney
And then they made
world.
me, hold on, they did make me an advocate, all right, a patient advocate in my center. Who knew that I would be with the ESRD network, Live on New York and stuff like that, being a PAC rep and all of these different things, a specialist, dealing with the area of what I deal with, with dialysis and transplants and stuff like that. I didn't even want it. No, girl, no, I didn't want that. Now, I don't know what you want to do in your center, but I mean, you can really get involved. That's what it's all about. You should. Everybody should get involved. I don't care what you do, but you need to get involved and be educated about your illness. Girl, what time is it? Where my watch? Where my clock? What? Oh, I gotta run. I gotta run. You know that lady's on. You know that lady I always tell you about. Girl, she's nice. She's smart. She's cute. Oh man, who don't love her? Who don't love her? Yeah, yeah, Lisa. Yeah, Lisa Baxter. The Lisa Baxter Show. You know why, right? Because this is the Lisa Baxter Show, giving you the 411 in the kidney world. Hey, everybody. Good evening, and good evening. Oh man, I got a fantabulous show for you tonight with a wonderful guest. As usual, we plan to deliver. Every time we plan to deliver. Snacks, whatever it is, hope it's healthy. If not, be limited. Watch that. Now get your snack out and everything like that, and let's take this ride, this drive, and this journey on the Lisa Baxter Show. Well, let me introduce my guest. I hope everybody's enjoying a nice long weekend. All right, for Memorial Day. Some people, I'm sure they're barbecuing. Keep your distance. Wash your hands. Do something around your home. Okay? I ain't mad at you. I understand, but let's stay alive and let's stay safe. My guest for tonight, he is Associate Director of Clinical Operations, right? He's self-employed. Okay, he's a former EMT at the FDNY EMS in New York. He's a physician assistant. He's sweet, he's nice, he's on point, and he's handsome. And I know him, y'all. Come on out, Mr. Timothy Sutton. Show yourself, my brother. Show yourself.
Good evening, everyone. How are you? How are you?
Alive and kicking. Welcome
Glad
to the Lisa Baxter Show.
Thank you for inviting me. My first time. I should have been here a long time ago. I'm pretty excited about tonight.
I'm glad I finally caught that. The real you in. It wasn't easy. You're a busy man on the run. A man that loved by the community, a busy man. Oh my God, I thought I would never get you, but I got you now. How about that?
I'm glad to be here. Thanks for having me.
You're welcome again. You're welcome again. Let's take this sweet journey. Let's go on, drive on in there, cruise up in that piece. Now, tell me something a little bit about what you do. I don't know which position you want to start with first, because I'm getting all three of them positions, probably four. All right.
They all kind of fit in together. My career started out as a volunteer EMT. I'm actually the first EMT that was ever produced by the New York and world famous Bed-Stuy Volunteer Ambulance Corps, James Rocky Robinson, the founder, along with Joe Perez. Rocky Robinson passed away recently, but I had the pleasure of knowing him for many, many years and being the first EMT that they put out in the street. I made him proud, and we always had a very good and strong relationship. And that organization, by the way, still exists, and it still needs help. You can always go in, check in to volunteer, 727 Green Avenue. That's in Brooklyn, New York. And that's the Bed-Stuy Volleys. It's worth it. Nobody's going to help our community before we do it ourselves. And so I started out as an EMT at Bed-Stuy Volleys. I went to school for nursing, but I wind up finishing up as a physician assistant, graduating from the Sophie Davis program here at the City College of New York. I work in emergency medicine and family medicine, and I've worked from anesthesiology to pediatrics to cardiology to general medicine. Right now, I'm partnered with a fine group of gentlemen, also providers here in New York City, physician assistants and medical doctors as well, in an urgent care here in New York called AG Urgent Care. And we're in five areas in the New York City community, 4 in Brooklyn and 1 in the borough of Queens. So we are still affecting our community, and I'm still volunteering in a way. And, you know, that's what I do. I just take care of my family and my people and my community.
Wow. Woo! That was a lot right there. I ain't mad at you. That's a lot said in one breath. But you know we're going to cruise it fast and we're going to take it a little slow on this ride. Now, how hard was it when you were studying, if you don't mind me asking?
I'm a horrible studier, so I have very bad study habits. So for getting the hardest part for me was sitting down, being still, and focusing. I say I have a flight of thought. I'm always a daydreamer. I've been a big daydreamer, but I actually did well in school. But studying is hard. You have to put the time in, and I buckled down and put the time in, and up to now it's paid off. So yeah, studying is tough, but it's doable. Very doable.
I'm sure. Now, you rode around and did things with EMT, the ambulance. What was that like to work in that capacity? Because I know it could be very difficult, very hard, very strenuous. So tell us a little bit about that.
It's strange because I feel like healthcare in general to me was a calling. And when I became an EMT, the calling got louder. Being an EMT entailed doing so many things, from transporting people to the hospital to being a social worker, you know, sitting down, listening to people's problems, you know, addressing things in the community. We dealt with a lot of things, from drug addiction to domestic violence to crime in the streets, with people shooting and stabbing and killing each other. A lot of folks who I worked with were exhilarated by all the actions that was happening. And when I first became an EMT, it was in the late 80s, early 90s, when New York City and Brooklyn was like the Wild Wild West. People were getting shot every day. So it was exciting in a sense, but it was still serving, because at that time, you can wait for an ambulance up to 30 minutes in New York City. And with the introduction of Best Volleys into the community, doing our first ambulance run by foot, we brought the wait time for an ambulance in New York City from almost 30 minutes down to less than 5 minutes. So I guess we did what we needed to do.
That's some fast feet. That's some fast running hard feet.
Yeah.
I ain't mad.
Some of our were by foot, and it just to show the determination of the people that were volunteering, that we don't have an ambulance, but we're gonna go by foot, and we were able to do so. And the first call I ever went on was a older woman who was at home, a senior who was at home. She was alone and just wanted somebody to talk to. And you go, wow, did somebody call an ambulance for that? But that's important. Loneliness and depression and all of these things are things that need to be cared for. You know, when we talk about health, most people just talk about the body. In more recent days, people are talking about the body and the mind, because if your mind ain't right, how's your body going to heal? You know, that's why right. That's why comedy is such a great thing when people are sick. It makes the mind feel better, so it makes the body feel better. So who wouldn't want to look at something funny if they're not feeling good? It'll spruce them up. Mm-hmm. You know, so, mental health. Mental health is important in our community, and that first call was a mental health call. And that had to be one of the most exciting calls, not the gunshots or all those other things. Bring a little peace of mind to a woman who lived alone, who's basically ignored by society, and to bring her a little comfort, man, that was one of the best calls you can ever run on.
Wow. Well, you know, a merry heart do a good like a medicine. So laughter is very good for the heart and the soul. You know what I'm saying? Absolutely. So yeah, you got to bring that comedy on. I love joking. I love laughing and putting it out there. Well, you know, one of the things I love about this is that you started out volunteering. Some people don't want to volunteer. They don't see the value in that. And I talk about that on the show because I volunteer on so many capacities with Jamaica Hospital. We really would Live on New York, ESRD network, the polycystic kidney disease. I can go on. But the point of it is you got to want to do it and you got to love what you do and make time for it. And so far you have shown that by even starting out like that. It had broadened your horizon so much that you came a physician assistant. From a volunteer to zoop over there studying, even though you said you had some things with studying, you still did it. You pushed on. I ain't mad at you. Come on now.
Yeah, volunteerism in the Black community is something that needs to be pushed a little bit more. I don't care what the organization is. If it's volunteering to tutor a kid with math after school, someone who works in the financial industry, volunteering to teach children about money, how to invest it, how to make money work for themselves. There's so many different things we can volunteer and do in our community to uplift our community. It costs absolutely nothing. It's about sharing information, and that information gives the community power, and that uplifts the community, and we don't have to look for others to do for us what we can do for ourselves. There's nothing in the world that's known that somebody Black don't know and can teach to someone and uplift a community and a group. Volunteering is what we need. Volunteer anywhere, at an ambulance corps, at a hospital, in a library, at a church, at a food bank, anywhere. Volunteer. It uplifts the community. It brings the community tighter together. And that's what we need as a people. And at time now, like in this COVID time, it's a perfect time to volunteer, to show that our main concern is humanity. Finance will always come, but without a humanity, what the good is money? So volunteer, folks.
Woo! Preach on, preach on, preach on. You ain't never lied. Come on here. Bring it, drop it all the way in there. Shoot, park that thing. Park it. So listen. Hey, wow. I don't even know how to jump off of that one. All right. I'm glad you blowing our mind with all of this, because this is what we want. You know what I mean? Now, what made you go into self-employment or doing things for yourself? How did that come about, sir?
I've always been a strong proponent of self-employment, especially in the Black and minority community, because when you have to depend on someone else to take care of you, you have to depend on them. You got to follow their rules. When in Rome, do what the Romans do. So I'm a firm believer that if I got to follow the rules, I'm gonna create my own Rome. So I decided to be my own boss and become an entrepreneur. And I'm never worried about walking in the office and somebody calling me in the office going, we really appreciate you. You did a lot of good work for you, but we no longer need your services. And that alone is enough to make me want to be self-employed. I don't want to have to depend or rely on anyone if I don't have to. If you have to, you got to do what you have to do. But as long as I can work for myself and take care of my family, I will do so.
Well said. Well said. Well, you're getting a lot done and you're doing a lot. You're a father, you're a grandfather. You look young now, but you're a father and you're a grandfather, and you're still out there doing and giving back. Everybody don't give back or know how to give back. So I'm glad you're saying a lot, because somebody out there want to know how to give back. Somebody out there actually want to give back. Everybody that not turning their head or not wanting to be bothered, somebody out there want to do something and want to give back. Now, how's it like in your office now with the COVID virus? And talk about the thing you do with the I think the medical teller thing you was telling me about.
Sure. COVID virus has caused a lot of people to have to do things differently. The day before we went into shelter at home was a different world. The world that we're going to come out on the other side is going to be totally different. And there are going to be some things that we're going to need to change and get used to. Social distancing, wearing masks, hand washing. Hand washing is very important. These things are very simple to do, and it makes life easier. So in our facilities, what we've had to do is we've had to take out some of the chairs in the waiting area, and we try to schedule people more so that there's no crowds in the waiting area. People come at a set time. Usually when they come in, they get escorted right into triage. They're triaged, they're seen, and then they're allowed to leave to kind of avoid crowding the area and waiting too long to be seen. That's one thing we've had to do. We've actually had to have people standing outside the office waiting to be seen, because people who make appointments, we can kind of control that crowd, but people who just walk in, we can't. So we've done some social distancing things, floor markings on the floor, trying to schedule more appointments to keep them distanced between each other, appointments and people being in the facility, things of that nature. And because of the separation and people not wanting to come out or not needing to come out, we've also been doing telemedicine. I do telemedicine 7 days a week for anybody who needs it. Telestat 911 at doxy.me. It's an excellent way to be seen. You can refill your medications. You can ask questions, consultations, because even if people are not really sick, people come to the doctor sometimes just because they need advice. And in the time of COVID-19, you don't want to be outside just to get advice and sit in an office with a group of people and run the risk of getting sick to get a question answered. So things like telemedicine actually helps to refill your regular monthly medications to avoid you from having to sit in a medical office. If your provider doesn't have telemedicine, it prevents you from having to go to the emergency room for simple things. You can get cleared to go back to work, and you can also be scheduled to have COVID testing and antibody serology testing through the blood at home. Someone will come out and do those tests for you. So that's how we've had to alter our services during the COVID-19 period. And it will remain this way most likely afterwards, because it's actually safe and convenient, and people like that kind of specialized individual service.
Well, I'm definitely glad that this is working for you and working for your office and working for so many people, because, some people want to find any way to get that personal touch. Some people, this is their only outlet to get out, or their only outlet to talk to someone, or somebody besides the family, if the family is not reaching out to them, or their, God forbid, their church or whoever is not looking on them or after them, or their caregiver. So it's good to know that the doctor cares. I know it means a lot to me that I have my doctor's, I have the cell phone. I could talk to him, I could call him. We was always good and always tight. I had him on the show. You know what I mean? I'm good with all of my doctors. I make sure they know each other and line things up together, so they can work together to help me.
Absolutely.
And they don't seem to have the voice. You know what I'm saying? So I like that you give that personal touch and you're willing to go out to do that. I am also glad that you never caught this, and being a frontline worker or a frontline person out there, you haven't came in contact with this where you have caught it. And I know you have been tested. So I thank God for that, for you and your life, and while you're out there, and anybody else out there, because we got a lot of family in the medical field.
Absolutely, we do. But I really appreciate the thoughts of kindness. But for the most of us, this is what we do. We don't even second guess running in to help. As a volunteer EMT, as an EMT who worked for the New York City Fire Department and HHC before that, and when something happens and you have that rescuer's heart, you don't think about danger. You run in, and then after the fact, you go, "Wow, what was I thinking?" And what you were thinking was, I'm here to help. It's my calling to try to save, and that's what you do. And I appreciate the fact that people are really appreciating frontline and essential workers, and not just nurses and doctors, but the housekeepers and the cats who work in the grocery store, the ones who do stock, the truck drivers. Especially the housekeepers. The housekeepers are cleaning up behind the nurses, the doctors, the patients themselves, the other patients sitting in the waiting area. They take on a lot of responsibility as well. So as a healthcare provider, knowing other healthcare providers, we love the fact that we're being appreciated, but we also love the fact that people are now showing appreciation to the people who are not thought about. When people go to the hospital, nobody thinks about the guy who's sweeping the floor or wiping down the desk, or the woman who's cleaning the bathroom. Now, those things are paramount to our survival and being alive, being sanitary. And these are the people that are doing it. And I want to give a shout out to all of the people who do all of the work that nobody else wants to do, like maintenance and cleaning and garbage and childcare for long periods of time, like all the moms who got to stay home with their kids because they're not in school. So, thank you. We appreciate all of the love that you've shown us as healthcare workers, but definitely show some love to some of the other essential workers, because they do a very tough and dirty job. They don't get recognized enough, and they surely don't get paid enough.
I know that's right. I know that's right. You have plenty of people out there. I mean, even the home attendants out there. You have the people that's still cooking and delivering, have the nerve to deliver your food or your medicine to you. I have my medicine delivered to me. Since I had my transplant, they always deliver it. I was talking to them today on the phone, They know me by name, they even recognize my number. And all of those things, you need all of that out there, because if the store wasn't still open, or the cab driver or Uber or the ambulance driver or accessory, whoever it is, didn't
Right.
get in their car to help, then we wouldn't be helped. It helps everything work. That's like being a cake. Everybody can't be the eggs or the sugar, but it takes
Right.
all of us to make the
Right.
thing
Somebody
work.
has to.
Now, what do you know about dialysis and transplants and stuff? Tell me something that you know about that.
Well, coming from a family that has a history of polycystic kidney disease, something that I shunned myself away from for so long, I just didn't pay any attention, hoping it didn't get me. And it didn't. I didn't get sick of anything, but I learned a lot about kidney health and taking care of the kidneys. The biggest problem in the minority community, and when I say minority, I mean poor folks. They can be Black, they can be white, American Indian. Diabetes and high blood pressure. They're the culprits in kidney disease. They're the biggest
Yeah.
culprit in kidney disease. And amongst minorities, high blood pressure and diabetes is it. And we talk about kidney health. I try to tell people kidney health is the most important health that the body can have. Science is showing that the kidneys run the body. The kidneys alert the body to all the signals of what needs to be done, when it needs to be done, if you're hungry, if you need water, all of those things, as well as being a filtration system for the body. So there's so many things that you can do to help keep your kidneys healthy, but people have to be willing to do it. And one of the biggest things that people don't want to do is change their diet. It's a simple thing. Diet change, exercise, how well you maintain your body, your physicalness. And people will take 50 pills before they'll eat a salad or go to the gym for 20 minutes 3 times a week. So part of being prepared and keeping kidney health in the forefront of people's minds, we have to do simple things like teach nutrition and exercise, and all of those other things will come into place. Heart disease, kidney disease, skin rashes, eczema, all of those things, they're all connected up to diet and health. Anybody who's been overweight and unhealthy and lost the weight and now is healthy will testify to it. Whether they go to church, don't go to church, they will testify. And I'm someone who can testify. I've been as heavy as 315 pounds. And in recent days, I'm down from 149 to 179 because you know what? I'm getting older. It's going to be harder to work out at 60, and I ain't trying to get there. So, kidney health, again, is paramount. It is one of the most important things in the world. Drinking water, taking care of your kidneys, which means doing things to make your body stronger and more healthier. And the first thing I should tell people to do is look at your diet, your nutrition. And when you fix those things, even small changes, you don't have to become a vegan or a vegetarian and get rid of meat, but most people eat meat at least 2 meals a day, every day.
Wow.
So,
I don't
and they don't exercise. Right. And they don't exercise. So learning nutrition will teach all of us things about our body, and including kidney health, and learning how to change things in our diet, small nutritional changes. You start to see the benefits of it, and then you start to do more. People try to jump in with both feet sometimes, and you shouldn't. Sometimes you just try something small. Say to yourself, you know what? I'm going to take soda out of my diet. That should be easy. Right? It's not, because that sugar is like a heroin. Your body calls for it. Your body calls for it. You start with that one thing. Start with that soda, and then you start with the chips. And then when you have them, they become things that are a treat, not an everyday thing. I ain't had a bag of chips in a month and a half. So you eat one bag of chips, you satisfied, now you're good for another month, 2 months. You're still having chips, but how much chips you're having? Portion sizes, the things that we eat. Nutrition is very, very, very strong preventer of disease.
Wow. Yes, yes. Wow. Well, put that out there. Put it out there. Now, have you ever had a kidney scare?
Yes, I have. Yes, I have. I was getting these flank pains that woke me up one night. And they were horrible. They were horrible. And I didn't know what was going on. So I went to the emergency room. Of course, they told me I had a stone. I was passing a stone. And they gave me some pain medication, hydrated me. Eventually I passed the stone. But it scared me because I told you we have a family history of kidney failure and kidney disease. So it made me scared. So I started going to the doctor and I had myself checked out. I had all of the kidney screenings done, the sonogram, everything. And it turns out I was fine.
That's good.
So I was cool, and it wasn't on my mind again. But then again, about 5 years ago, I got given 2 antibiotics while I was in the hospital. Both of them renal toxic, and it caused my creatinine to go from 0.8 to 2.6 in 6 hours. My creatinine has not been down under 2 since then. I mean, I still have kidney function. I'm controlling my blood pressure. I'm controlling my diabetes. I've stopped taking all medications again through diet and exercise. And I don't starve myself. I pay more attention to my kidneys now. And I didn't before because I thought I was over it because of the scare and then getting evaluated and being said, oh, things are fine. It was just a stone, no big deal. I got complacent again. And then I had another scare. And yes. The thing about kidneys, you can't go back. And if you don't get a new kidney, you're on a machine 3 times a week.
Yes, say that. So, preach about it.
I'm just more conscious about it now. But yes, I've had a kidney scare before.
There's nothing like a scare to shake you up and wake you up. How about that?
Absolutely. Absolutely, indeed.
Oh. Yeah, well, I always known you to be smart. I always known you to work hard. I always known you to be respectful and loving and everything because you're my nephew, But I even as a human being, as a person, I always been proud of you and very happy that you're doing so well and you're so involved with your community, with your family, with your children, grandchildren, pop, and the whole business.
I'm a pop.
Yes. Now, before I end the show, is there anything that we forgot to say? Mr. Steve Belcher got a hot show after this one.
I don't think so. I mean, I kind of enjoy the time being able to sit down and talk with you and just speak freely. So I'm gonna throw another bit in there for another appearance if you like one day soon. I love this. I actually had a good time. And I would love to do this again.
Well, the funny thing is everybody that's scared to do the show or worried about doing it, after they do it, they say the same exact thing. And it makes my heart happy. It tickles me at the same time. I book every 3 months. I'm booked all the way up to August? Was it August? Yeah, up to August. So I'm still working on that, but I ain't mad at you. Why not? And well, you also have another offer for somebody else in the network. So I ain't mad about that either. Use it all. It's all about us working together. You know what I'm saying?
Absolutely.
Now, if there's someone out there that want to be an entrepreneur or want to start out some of the things that you did, what advice can you give them?
Oh, definitely. You have to have a plan. You have to have a plan. You don't definitely need to know how you're going to execute it, but you have to have something to work with. You have to create a skeletal system in your plan to give you some direction. Also, tap into people who know. Don't be afraid to ask questions. Anybody who you think knows something that you can use, ask them. Read. The library is your friend. I say library. I'm a little old school, but the internet is your friend. You can get on the internet, the Better Business Bureau. You can go to the federal government pages. So many different pages. You have different people who teach you how to start different types of business, how to market on the internet. I mean, there's so many different ways to start a business. There's nothing that's not needed. My 71-year-old mother now is crocheting and knitting face masks, and they're selling well because it's a need. So you can be an entrepreneur doing tons of things. Don't think it's irrelevant. There's always something that someone needs, and you may just have what they need. So have a plan. Tap into people who know and go for it. Don't be afraid. Go for it. I've been afraid before. It slows you down. When you let the fear go, you excel. Let it go. Ask questions, and you got to put the work in. Nothing's going to be easy.
Woo! Well said, nephew. Well said. Mad at you. Now, anybody you want to give a shout out to? Maybe family or business or anything like that? Anybody in your heart's desire to give a shout out to, love?
Absolutely. I want to give a shout out to all the healthcare workers on the front line, but I want to give a special shout out to the nurses, doctors, all of the ancillary staff and supporting staff at Brookdale Hospital here in Brooklyn. Brookdale Hospital always take on the toughest cases. We always worked with less than what everyone else had, and we always left the next morning happy, pleased, and surprised that we were able to help people and save lives. Brookdale Hospital is full of heroes, everyday heroes, even when there's no pandemic. I want to give a shout out to AG Urgent Care here in Brooklyn. We got 5 locations, 4 in Brooklyn, 1 in Queens. Our main offices are at 1349 Broadway here in Brooklyn. Also, we have telemedicine, Telestat 911. You can go right to Telestat 911 at doxyme.com and see me in the office any day of the week from 8 a.m. to 6 p.m. And shout out to everybody who's hunkering down during this pandemic. Stay strong, stay safe, and thanks for having me.
Oh, that is fantastic. That is fantastic. Good. Yeah, we all got to show some love and be about it. You know what I mean? Tell Joanne, keep making them things. Even though I'm not a crochet, I might want one of them masks. I ain't mad at it. Okay. And definitely everybody. All right. So be good. Take care. And thanks a million blessings.
You do the same. Right. Have a good night. And I can tell the host I love her. That's my aunt. I love you. Have a good night, Aunt Lisa.
You welcome, boo. You welcome. Woo. Well, you guys have heard it. You have heard it 101%. That's right. I said it. You have heard it 101%. You know, I don't want you to ever be ashamed to come on my show or be on my show, whether you're a family, a friend, a foe, or somebody with a profession or a resource. You are always welcome, because at Urban Health, we are a big, fat family, and we want you to be a part. Tell your story. Put your feelings out there. We love on you. We praying for you, and we got your back. Good night. God bless. Be well. Peace. Y'all ready for this? Yeah. This is the Lisa Baxter Show, giving you the 411 and the kid me one. My girl, and say, this is